Welcome to the Kanski lecture series, chapter 6, Conjunctiva. In this part, we are going to study about the conjunctiva. So, let's get started. With the introduction, we are going to study about the anatomy of the conjunctiva. So, anatomy of the conjunctiva. The conjunctiva is a transparent mucous membrane that lines the inner surface of the eyelid and the interior surface of the globe, terminating at the corneoscleral limbus. It is richly vascular, supplied by the anterior ciliary and palpebral arteries. So, what is a conjunctiva? Conjunctiva is a very thin mucus layer that is basically covering the sclera. And what is it? It starts by the corneoscleral limbus, and then it goes into the bulbar conjunctiva, and it surrounds the sclera, and then it surrounds the fornix, and then it terminates at the eyelid margin. It is supplied by the anterior ciliary and palpebral arteries. There is a dense lymphatic networks with drainage to the preauricular and submandibular lymph nodes uh, corresponding to that of the eyelids. So it is very important that it has also a lymphatic drainage. Why? Because in certain viral condition, there are the enlargement of these lymph nodes, especially the preauricular, that is uh, uh, in front of the ears, and submandibulars. It has a great protective role, mediating both passive and active immunity. Anatomically, it is divided into following: the palpebral conjunctiva, the phoenicial conjunctiva, and the bulbar conjunctiva. So, the conjunctiva is divided into three types based on its location. So, what's its location? Basically, when it surrounds the inner surface of the eyelids, it is called palpebral conjunctiva. When it surrounds the deep fornix, that is a between the eyelids and the sclera, there is a gap. It is called phoenicial conjunctiva, and one that is covering the sclera is called the bulbar conjunctiva. And remember that there is also beneath the conjunctiva on the sclera, there is a tenon capsule as well. And tenon capsule is basically an extension of the periorbital tissue, and it got merged at the corneoscleral limbus. The palpebral conjunctiva starts at the mucocutaneous junction of the lid margin and is firmly attached to the posterior tarsal plate. Very important, the tarsal blood vessels are vertically oriented. So that is very important. Phoenicial conjunctiva is loose and redundant, and that is why whenever there is a chalazion, we give an excision vertical in the tarsal conjunctiva. Why? Because there is a tarsal conjunctival vessels are usually vertically oriented. Phoenicial conjunctiva is loose and redundant. The bulbar conjunctiva covers the anterior sclera and is continuous with the corneal epithelium at the limbus. Radial ridges at the limbus forms the palisades of Vogt, the likely reservoir of the corneal stem cells. The stroma is loosely attached to the underlying tenon capsule except at the limbus where the two layers fuse. The plica semilunaris, a semilunifold, is present nasally, medial to which lies a fleshy nodule cruncle consisting of a modified cutaneous tissue. So basically, bulbar conjunctiva is what is attaching this a white part of the sclera, and the underlying tenon capsule is loosely attached, but at the limbus they become fused. The conjunctiva forms a palisades of Vogt at the corneoscleral limbus, and here it is a corneal stem cells are present. That is important for the regenerating of the corneal epithelium. And one very important thing is that around, so this is an eyelid, and so you can say this is a left eyelid. There is a fleshy nodule that is present, which sometimes contain here, that is a cruncle. And another fleshy mass that is present, pink color, that is a plica semi-lunaris. Histology, the epithelium is a non-keratinizing and around 5 cell layer deep. Basal cuboidal cells evolved into a flattened polyhedral cells, subsequently being shed from the surface. Mucus secreting goblet cells are located within epithelium, being more dense infranasally in the fornix and in the fornix. Very important. Where is the most densely located goblet fiber? Is that it's infranasally and in the fornix. So this is an epithelium of the conjunctiva. So it has a basal cells, it has a non-keratinized, it is not keratinized, and it's about 5 cell layer. The basal cells are cuboidal in shape, and then they become the flattened polyhedral cells, and among it there is a mucus containing goblet cells, secreting goblet cells. So mucus secreting goblet cells secretes the tear film of the mucin layer of the tear film. Then there is a stroma, which is also known as substantia propria, consists of a richly vascularized loose connective tissue. The accessory lacrimal gland of Cross and Wolfling are located deep within the stroma. Secretion from the accessory lacrimal glands are an essential component of the tear film. So stroma also is it is basically a connective tissue which contain the which contain lymphatics and which contain which contain the vascular supply, and it's also contain accessory lacrimal gland which is known as gland of Wolfring and gland of Cross, and what they secrete is the what aqueous layer of the tear film. Conjunctival associated lymphoid tissue cult is critical in the initiation and regulation of the ocular surface immune response. It consists of lymphocytes within the epithelial layer, lymphatics and associated blood vessels within a stromal component of lymphocyte, with the stromal component of lymphocytes and plasma cells including follicular aggregates. So basically there is a lymphoid tissue in the conjunctiva which has basically two components, that is one is in the epithelium and other is in the stroma. In the epithelial layer it contains a lymphocyte and some lymphatics with the associated blood vessels, whereas in stromal component are lymphocytes and plasma cells plus plasma cells, and they can become the follicular aggregates as well. Clinical features of conjunctival inflammation. So what are the features of conjunctival inflammation? Symptoms. Non-specific symptoms include lacrimation, grittiness, stinging and burning. So non-specific symptoms, if there is any conjunctival inflammation, you can get a foreign body sensation, you can get a watery discharge, you can get irritation, and even the burning is also a symptom. Itching is the hallmark of allergic disease, although it may occur to a lesser extent in blepharitis and in patient with dry eye syndrome. So where does the itching occur? It occurs in basically allergic disease, but sometimes blepharitis and dry eye patient also complain of itching. The visual acuity is not usually affected. Significant pain, photophobia or a marked foreign body sensation suggest corneal involvement. So when there is a corneal involvement, there is going to be pain, there going to be a sensitivity to light, and there will be the foreign body sensation. Discharge. So depending on the type of discharge, you can identify what is the basically causation of the conjunctivitis. So if the discharge is watery, it is mostly going to be viral or allergic. Watery discharge is composed of a serous exudate and tears and occur in acute viral or acute allergic conjunctivitis. Mucoid discharge is typical of chronic allergic conjunctivitis and dry eye. So mucoid is in the dry eye and chronic allergic conjunctivitis. Mucopurulent discharge typically occurs in chlamydial or acute bacterial infection. Moderately purulent discharge occur in acute bacterial conjunctivitis. Severe purulent discharge is suggestive of a gonococcal infection. So severe purulent, gonococcal infection, and moderate purulent is basically acute bacterial conjunctivitis. So there are different types of conjunctival reaction. It can be hyperemia, hemorrhage, chemosis, membrane formation, infiltration, subconjunctival cicatrician, follicles, and papillae. So conjunctival reaction, hyperemia is a diffuse, beefy red, more intense away from the limbus, is usual in bacterial infection. The conjunctival injection should be distinguished from the ciliary injection of the iridocyclitis. Very important line which we do not tend to take seriously, but it's very important. So hyperemia is basically the congestion or redness of the conjunctiva, which is basically very important sign of any conjunctival inflammation. So how do you identify that it is a conjunctival inflammation or conjunctival injection? Basically the conjunctival inflammation is basically on the part of the sclera, but usually sparing the corneoscleral limbus. When the only the corneoscleral limbus is involved, it basically suggests of the ciliary injection. So you can see figure 6.2a in that. So you can see that typical conjunctivitis picture showing the redness of the conjunctiva, but there is a relative sparing of the corneoscleral area. Hemorrhage may occur in viral conjunctivitis when they are often multiple, small and discrete, petechial, and severe bacterial conjunctivitis when they are large and diffuse. So hemorrhage can also occur in conjunctivitis when they are very small. Basically they are more common when they are small, and penny sphere can cause the subconj hemorrhage as well. 6.2b, you can see the subconj hemorrhage in case of conjunctivitis. Chemosis, conjunctival edema. So chemosis is basically edema. You can see the fluid filled in the conjunctiva, and basically that is usually yellowish hue. Conjunctival, and that is more commonly in any kind of allergic conjunctivitis. Conjunctival edema is seen as a translucent swelling which may protrude through the eyelids. Acute chemosis usually indicates a hypersensitivity response, for example, pollen, but can also occur in severe infective conjunctivitis. Subacute or chronic chemosis has numerous causes. So when there is a local chemosis, local cause are, for example, thyroid eye disease, chronic allergic conjunctivitis, ocular and eyelid surgery, or trauma. Increased systemic vascular permeability, for example, allergic condition, infections including meningitis and vasculitis. Increased venous pressure, for example, superior vena cava syndrome and right-sided heart failure. Decreased plasma osmotic pressure, for example, nephrotic syndrome. So you can see here there is a conjunctival chemosis or edema in it. You can see that there is a pulping of the conjunctiva, what we can say. Then there is a membrane formation. There is a pseudo membrane formation and a true membrane. Pseudo membrane is basically the membrane that can be peeled away without causing any damage to the conjunctiva. But true membrane is when the membrane is formed on the conjunctiva, like when you peel it, it causes the bleeding of the conjunctiva and tearing of the conjunctiva as well. Pseudomembrane consists of a coagulated exudate adherent to the inflamed conjunctival epithelium. So, what it is? It is a coagulated exudate. They can be peeled away, leaving the underlying epithelium intact. True membrane involves the superficial layer of the conjunctival epithelium, so that attentive removal leads to tearing. The distinction between a true membrane and a pseudomembrane is rarely clinically helpful, and both can leave scarring following resolution. So, both can leave scarring. Causes include severe adenoviral conjunctivitis, gonococcal, and some other bacterial infection, streptococcus, corynebacterium diphtheriae, Legionnaires conjunctivitis, and Stevens-Johnson syndrome. So you have to remember the causes of every type of sign of the conjunctiva. So corynebacterium diphtheria, it also causes membrane formation in the intestine, pseudomembrane formation in the intestine. So you can give that it can also cause in the eye. Legionnaires conjunctivitis and adenoviral is very common. It has most of the signs of the conjunctiva. So membrane formation is one of them. Stevens-Johnson syndrome as well. Infiltration represents the cellular recruitment to the site of chronic inflammation and typically accompanies a papillary response. It is recognized by a loss of detail of the normal tarsal conjunctival vessel, especially on the upper lid. So you can see that you cannot see normal conjunctival vessels when there is an infiltration. So there are D is showing the membrane formation. So you can see that there is a membrane formation, and in this E you can see the cellular infiltration, and F is showing the scarring after the resolution. Next is the subconjunctival cicatrization. Scarring may occur in trachoma and other severe form of conjunctivitis. Square scarring is associated with loss of goblet cells and accessory lacrimal glands and can lead to cicatricial entropion. Very important. So whenever there is a conjunctival scarring, it causes the entropion, and when there is a skin scarring, it leads to ectropion. Follicles and papillae. So very important, you have to distinguish between the follicles and papillae. One thing very important, that follicles are usually formed in viral and in bacterial conjunctivitis, whereas papillae are usually formed in a case of allergic conjunctivitis. Very important. Follicles sign multiple discrete, slightly elevated lesion resembling translucent grain of rice, more prominent in the fornices. Blood vessels run around or across rather than within a lesion. So you will see that when there is a small type of lesion that is occurring in case of a follicles, and you can see most commonly they are located at the fornix, and blood vessels are running across but not within the lesion. Histology show a subepithelial lymphoid germinal center with the central immature lymphocytes and mature cells peripherally. So subepithelially, what you can see, that there is a lymphoid germinal center, and there is a center is an immature cell, whereas a periphery is a mature cells. Causes include viral and chlamydial conjunctivitis. So I told you that viral and bacterial, you can see follicle in the type of conjunctivitis. Perinode ocular glandular syndrome and hypersensitivity to topical medications. Very important, you must remember these causes of the follicle conjunctivitis. Small follicles are normal finding in the childhood folliculosis, as are follicles in the fornices and at the margin of the upper tarsal plates in adults. Papillae can develop only in the palpebral conjunctiva and in the limbal bulbar conjunctiva, where it is attached to the deeper fibrous layer. So where we can find the papillae? Papillae we can find at the corneoscleral nimbus. So that is a limbal papillae, we say. And one you can see at the tarsal plates, not anywhere else. Signs: in contrast to follicles, a deep vascular coat is present. Vascular core is present. In contrast to follicles, a vascular core is present. Micropapillae forms a mosaic pattern of elevated red dots as a result of a central vascular channel. Macropapillae less than 1 mm and giant papillae greater than 1 mm develop with the prolonged inflammation. Apical infiltrate or staining with fluorescence or a presence of mucus can be present with the marked activity. Limbal papillae may have a gelatinous appearance. So one thing you must remember, that there are types of papillae: micropapillae, macropapillae, and a giant papillae. Micropapillae are normally not seen very well. Macropapillae is usually less than 1 mm and greater than 1 mm is usually giant papillae. And what happens is here, it has a mosaic like pattern. You can see like they have a mosaic appearance like that. Histology shows a fold of hyperplastic conjunctival epithelium with fibrovascular core. So there is a vascular core within the lesion and a subepithelial stromal infiltration with inflammatory cells. Late changes include superficial stromal hyalinization, scarring, and formation of crypts containing the goblet cells. So very important. So what happened is that the epithelium is what? Hyperplastic. Conjunctival epithelium is hyperplastic, and within a subepithelial area there is a fibrovascular core and a stromal infiltration with inflammatory cells. And what happens when there is a late changes? There will be the hyalinization of the stroma, there will be scarring and formation of crypts. Causes include bacterial conjunctivitis, allergic conjunctivitis, chronic blepharitis, contact lens wear, and superior limbic keratoconjunctivitis and floppy eyelid syndrome. Lymphadenopathy. The most common cause of the lymphadenopathy associated with conjunctivitis is viral infection. It may also occur in chlamydial and severe bacterial conjunctivitis. Very important. Chlamydia is usually like an adenoviral, which is having most of the signs and symptoms related to the like adenoviral. So chlamydia also causes lymphadenopathy. And severe bacterial conjunctivitis, especially gonococcal and perinocular glandular syndrome, the preauricular site is typically affected. Tip: viral conjunctivitis tends to occur in epidemic and commonly causes preauricular lymphadenopathy. So that's it for the part 1 of the conjunctiva. See you in the next lecture. Thank you very much.